So amalgam fillings are often referred to as silver fillings. They're comprised of 50% elemental mercury and then a 50% combination of silver, copper, tin, and zinc in decreasing order like that. And we mix them together, hence the name amalgam. And they've been banned in many countries. They've been banned in Europe, and California is trying to completely wipe them out. Most dentists are aware that there may be some problems or controversy surrounding amalgam, but it is still being taught as a viable way to fill posterior teeth and dental school. And this is where we sometimes have a breakdown between types of dentists with looking at evidence-based medicine and what is current. So we were taught in our cardiology model as follows with Dr. Mark Houston, that a lot of the cardiovascular problems are directly caused from heavy metal burdens, toxic heavy metal loads that patients don't even know that they have. And heavy metal testing isn't done in a lot of communities. They don't even offer, in my community in Atlanta at the health department, testing for lead poisoning. So a lot of people are walking around just ignorant. They don't know if they may never be tested. That would cost something out of pocket. So we're trying to reduce this usage of heavy metals when we know that they're so toxic. You see, over time, these silver fillings get kind of hammered out. Now, they say that in the first 5 years that a filling has been placed, that's when it's really going to leak the most. But when you have an aging filling where the margin, the seam between the tooth and the filling itself is beginning to break down, you'll get this gray discoloration. You may get little places where if we had a picky, pointy instrument, we could stick it in there. The patient may get a funny taste as bacteria is leaking into there. But anytime that there's friction on this amalgam, anytime that there's heat, not to mention it's always at least 98.6 degrees inside the patient's mouth, it is going to gas off some of this mercury. And this is a report that was published in the textbook Epigenetics, the Environment and Children's Health Across Lifespans in 2016 by Springer Publishing. And it involves part of a paper that was put out by some of the IAOMT dentists with respect to showing the toxicity of mercury. Dental amalgam on a daily basis is said to give off between 3 and 17 micrograms a day, where fish and seafood in the diet, if you're eating fish and seafood several times a week, you're going to give off an average of 3.3 micrograms of mercury a day. And so the amalgams, there's a high correlation, for instance, with like a mother, an expectant mother, and how much heavy metal burden that fetus is going to carry. The more heavy metals in the mother's mouth, the more heavy metal burden that fetus will have. We caution mothers about not eating seafood and not eating certain foods when they're pregnant, but a lot of the mothers are walking around with these amalgams in their mouths. If you took, well, the average filling is going to have between 750 and 1,000 micrograms. So 1 gram, 1 paper clip weight of mercury in the filling. And if you took that filling out, as soon as you take it out, it's considered toxic waste. But we don't consider it toxic waste in the mouth, ironically. If you were to take that same filling and put it in a lake, a 10-acre lake, the marine life would be so potentially so contaminated by that filling that you wouldn't be able to fish in the 10-acre lake and feel like you could eat that fish without the fish being toxic. So it's something that we want to talk about and create more of a public awareness about. About 80% of the mercury that's released when this friction happens in the mouth by dental amalgam is absorbed by the lungs, and it's passed to the rest of the body, particularly the brain, kidney, liver, lung, and gastrointestinal tract. And in the 1980s, we had some studies done with sheep and with monkeys, where within the first 48 hours of the filling being placed, of silver filling being placed, the mercury there was mercury all of a sudden that could be detected in both brain tissue and gut tissue. I'm going to sail on through because we have a lot more I would like to cover this morning. I could talk about this for another 30 minutes. The IAOMT is a group that has established a SMART Protocol, which stands for Safe Mercury Amalgam Removal Technique. And this is something that some dental offices try to cover in their office. So these are slides from a patient that I see. And some of the protocol involves you want to use non-latex gloves, so we have all vinyl gloves. We offer chemical testing to patients either through Clifford or Melissa testing. where I work with an integrative doctor in my area. We have a special water line called a MARS unit, where all of the water that leaves the office when we've been even cleaning someone's teeth, it's gonna sort out the heavy metals that could be in the wastewater, so it doesn't get in our rivers and streams. Because today in the United States, dental offices are the top contributor of mercury to our rivers and streams. And we also have a very souped up HEPA filter. It looks like an elephant trunk. That's what you see in the white here. The rest on the patient's tummy when we take fillings out. We have the patient rinse with activated charcoal before and after the procedure. We drape them up. We put a nasal cannula on them with oxygen. And then we go ahead and we create really a surgical site to take out an old filling. And then we take the old filling out. And then there's some cleanup that happens at the end. That's the old filling that's been taken out. And we feel that that's a very important way to cut down on the mercury that the patient's being exposed to, because we're going to re-expose them to a lot of it when we take out a filling. So that's why we create that surgical field. And there's been a number of studies cited where dental office workers have lower rates of fertility. Dentists have 5 times the rate of needing medicine for heart problems and neurological problems in retirement age. So in our industry, we realize that we have a problem. The dental office staff is often the ones to suffer, and a lot of us are not even aware, because it's still not being taught in some of the mainstream dental programs.